Okay, good afternoon and happy Friday to everybody, and thank everybody for showing up. Again, if you remember or recall in my email, this is going to be a little bit shortened to what we're used to based on a lot of our legislative members who have a lot of, being in the middle of the session, they have a lot going on, so I think a lot of them may or may not show up, but this is where we are for right now. I do want to take 1 second. I did have an invited guest that you may see in the list, and that is Kathy Culbertson. She is the PRIM from Iowa. I extended an invitation to the other PRIMs. They are just getting ready to start executive committee meetings and even form their executive committees. So she will just be sitting in and listening and seeing how we run. So welcome to Kathy. Okay, so to start off, there's been a lot going on in the last 6 months and not a lot for the executive committee to do other than to keep engaged and to understand where we are. What I wanted to do today is just do a global overview of the PRIN project and to what was expected, what the PRIN project actually was, where we have been, where we are going. And I wanted to start off, I got a few notes here. You can stop me at any time and ask some questions, but what I wanted to do is just kind of remind everybody what PRIN was, what it's supposed to do, what it's expected to do, and all of our parts within the project. So I want to start with Arnold Ventures. Arnold Ventures is our funding, basically they're funding the project. So I pulled some information off their website, and Arnold Ventures, they have a couple quotes on there. We focus on correcting systematic failures through evidence-based solutions. And in particular to prisons, we will work with partners to develop bold ideas to transform culture, improve conditions, and reduce the reach in our correctional systems. Basically, that gives you an idea of where Arnold is coming from, what they like to fund, at least in the correctional side. And under their tab on prisons, their approach is to what they would like to see, and utilizing various projects that they fund is to safely reduce incarceration, increase transparency, accessibility, and accountability within prisons, promote dignity and improve well-being for the people in prison, both the incarcerated and the staff, and to improve the preparation of successful reentry of the incarcerated. So those are pretty profound mission statements and approaches, and just that gives you an kind of a global view of where and what Arnold Ventures was thinking when they funded this project. So part of that, they have engaged our research partner, and that's the Urban Institute out of DC. And I'm going to give you some of the same information off their website. Urban Institute, they providing evidence to accelerate solutions, determining what data and evidence would accelerate the most promising of ideas, which is a lot of the basic. I have a raised hand, Jesse.
I didn't want to interrupt you. I was going to do something additive, but since you're talking about us, maybe you should finish that and then you can invite me in as needed.
Okay, absolutely. So under Urban, they have a mission of providing technical assistance, facilitating troubleshooting, planning, and implementation, developing performance metrics, data collection tools, and local research partners, building collaborative infrastructures, conducting policy analysis, identifying, implementing evidence-based practices, developing evaluation methodologies, and delivering foundational trainings. So that is what directly from the Urban's website, and I will, Jesse, you wanted to jump in?
Yeah, I think the thing that I was going to add just for everybody, and there's probably, depending on, with the various work that people do in this meeting, different degrees of familiarity with Arnold Ventures and what they do in the urban. I mean, Arnold's a pretty big, and they've become a very prominent funder in the justice space. And just to say, I think part of their motivation for creating this project and engaging specific states is to really have that be an engagement. And there's some national level things that we're doing about, looking through the research and helping develop a research agenda for understanding what's going on inside prisons and what we need to know and what we don't know about that. But I think that, this project is really a very big center of gravity of their thinking about that and what work needs to be done and where they need to go. And they're, very actively listening to us and trying to, understand what, we're learning from the work to kind of guide their investments and their thinking about where they want to go strategically. So I thought I would add that in as part of, this was a very foundational investment and piece of work and where they want to go around, prisons and incarceration in general.
Right. Thank you, Jesse. Yes. I'm just trying to get an overview of how we fit into this piece. I know we all have what's directly in front of us and what attracts our attention, but as I go forward, what Vermont DOC is looking for, what UVM is looking for, what Urban is looking for, and ultimately what Arnold Ventures is looking for, that we all have a significant piece in this. And even though we are looking individually at certain things or what we'd like to see, we are contributing to a national project that involves the 4 other states. So any other questions there before I move on to the actual PRIN project? Okay, seeing none. So the Prison Research and Innovation Network, and I am pulling this directly from the information that Urban put out. So the PRIN project is to support interested states in researching and improving prison culture, operations, and design. The goals are to develop better understanding of prison environments and the relationship to safety and well-being of those who work and live there. The terminology I'd like to change on that, but that's just a personal thing. Enhance prison capacity for collecting data, promoting transparency and accountability. Design, implement, and evaluate data-driven, evidence-based, operational, and programmatic innovations. Improve prison conditions, including those that support rehabilitation, self-betterment for the incarcerated individuals. So we have been steadily working on setting ourselves up for at least our initial evaluation for that. And looking at the project PRIM under the Vermont DOC, I took a few things based from the RFP of what Vermont DOC was looking at for the PRIM. So as part of this project, this is what the DOC is expected to contribute. Vermont DOC will support, use community-based participation research approaches, dedicate resources for repeated administration of data collection and dissemination, make aggregated and de-identified data on prison environment operations available to the public in a timely manner, ID state-level policy changes, administrative, legislative, and operational, ID areas of innovation using data-driven process, and expedite processes pertaining to data access and protocols. Those were at the time when Vermont DOC applied for this project. That is some of the statements made of what Vermont DOC would like to see from this project. Is there any comments about it? Do we see any changes? Yeah, I'm just taking it directly from when we applied for the grant, just to give you an overall view of where we are and where we are coming from and where we may be going. Within the project, expectations based on the project for UVM, they will help or facilitate in the design and conduct the climate survey, develop other data collection tools, identify, collect core set of performance metrics and data, assist in articulating proposed innovations and related outcomes to be used under phase 2. Of course, there's a whole lot more to that, but this is just giving you a basic understanding at the time that PRIN started what the expectations were. As for my position as the PRIM, the expectation was that I would coordinate, facilitate, implement planning activities, direct project, executive committee and steering committee meetings, manage day-to-day project work, ensure compliance to project goals, timelines, assist with evaluation strategies, coordinate, align, facilitate project activities with all other related Vermont initiatives, identify data landscape, capacity, capability, and a needs strategy, and be a visible member of the leadership team here at Southern. So if anything sounds different than what anybody remembers or would like to articulate, feel free. The PRIM steering committees. So the steering committee is a subset of our committee that's here today. It comprises members from Urban, UVM, and DOC on-site, as part of administrative services. So the steering committee was tasked with ensuring the completion of day-to-day work, phase 1 and phase 2, supporting research partners in staff and incarcerated engagement, providing guidance, support, development of the climate survey, IDing best practices for administering data collection and data sharing, develop and agreeing on shared goals, sharing information with partners, stakeholders, etc., and present recommendations for change informed by the results of the climate survey and the administrative data analysis. That is taken directly from the charter for the steering committee. The executive committee, I do have an executive committee here, one. Executive committee, which is everybody here taken directly from our charter. You are tasked to give advice on strategic decisions, provide knowledge, expertise, and resources to assist with the project, leverage information from the project to make change actionable, and support, advocate, and act upon recommendations from the project. That is taken directly from the charges from the project for each specific partner, stakeholder, and committee. From this, I've got a few more things, but I just wanted to stop there and see if there's anybody who wants to speak to any of that, anybody who wants to make some additions. I know it's a lot of information real quick. Any thoughts, comments? Okay, it sounds like everybody wants to get out early on a Friday. That's from the RFP, the Vermont Department of Corrections expectations. So with PRIN, we wanted to develop and validate humane and rehabilitative correction model to improve the health and well-being of those who live and work in the prison, create opportunities to promote transparency and accountability, increase capacity of data collection, research, and reporting, and develop sustaining cross-sector collaborative and stakeholder engagement. That is what originally was the expectation at the time that I read through reports of what DOC wanted from PRIN. So we're just a little over a year in, and I have been here for 6 months. And within that time, there's so much that's been going on, but I'm just going to give you a highlight of some of the stuff year to date that has been done. Since coming in, since September, UVM has started conducting interviews, conducting focus groups and research councils with staff and the incarcerated. This was before COVID protocols prohibited them from entering the facility. We've conducted biweekly steering committees since then that have been managing and looking at day-to-day workings and strategies. We have conducted our bi-monthly executive meetings since, well, before I got here. I think I sat in on the second one. Is that correct, Jess? We've gotten to the point where we've been doing some cross-site communications with the PRIN. I've been in contact with the other 5 sites, and we've done some information sharing on just some project management within the 4 or 5 states. UVM has, our research partners, Kathy and Abby, have been working hard with the ability, to reach out and speak with the incarcerated and the staff to a point where they were conducting informational meetings with them via Teams to build the survey, also in conjunction with Urban and adding their core questions, and to integrate that all with all the information that they gathered from their interviews to create the climate survey. I know they are very close with that. They're making some adjustments with some last minute core questions that Urban had decided to use for cross-site comparison to compare information between the 5 states. So they are working on that now, and it's been a bear of a chore, but I know they are waiting with anticipation for the IRB process to finish up, and hopefully we are very close for the administration of the survey. Kathy, would you want to mention anything about where the status is on the survey?
Well, just that we got sort of final survey wording from Urban on Tuesday, and so any changes to the survey have to go back to the IRB. So we're hoping that process will be relatively quick, but it's very hard to predict. We're thinking it's okay because maybe we'll be able to get inside to do the survey administration, but if it ends up stalling long enough. But either way, I mean, we'll be poised and ready to go soon. And apparently I'm getting vaccinated in a week, so that's good too. So anyway, yeah, it's moving, but and we're trying to keep engagement with people inside just to let them know that we haven't forgotten about them because it's been delayed, and just to keep the enthusiasm up. And so that's about it.
Thank you, Kathy. One of the engagement activities was a art project that UVM provided some art supplies and some directions to keep the incarcerated population engaged, asking them if they care to create art to submit, just to keep them engaged. It's just an activity during the COVID process because everybody's dealing with the pressures and the mental health issues that COVID can present. So it was an engagement piece as well as a distraction piece to keep minds occupied. We have received some back, so those will be getting sent out to UVM shortly. And then we are waiting, as Kathy stated, we do have some flexibility. We have plans created on how to administer the test if they can be in here and if we can't. As of right now, with UVM not being prohibited from being in the facility, the survey will be conducted over a 10 to 12 day period during nighttime lock-in that I will be facilitating either the administration of paper surveys or tablet surveys, however that is going to come to fruition, because I do not know the status of the tablets yet, but it's anticipated that some of the surveys will be presented tablet style for those that need that extra help taking the survey. So we do have a couple contingency plans on how to proceed with that. We have pushed off the survey I think we're looking at the end of March, first part of May to start the survey process on both. So we do have that plan. Admin data extracts over the last several months. We have had an accelerated process of providing administrative data from our OMS system and various other areas that data had been collected, and Jessica and Krista and the team that Krista manages has been doing an outstanding job of digging into OMS and pulling out the data needed. We also have successful couple of meetings with Max Titus and the medical group about a data extract from that group. So that is very close to being ready for upload for UVM to have. Jessica, am I missing anything on that?
Just that we're also in talks with programming. So that's kind of like our last little piece before we get into some staff data once we get that collaborating like staff data with EHR. Once that's done, then hopefully then we'll finally have all of our extracts ready so that it's an easy pull each subsequent year.
Right. And one of the other things that has been done is I have been partaking in a 6-month graduate course on the understanding of how a facility is run in Vermont. And I want to thank Mike Lyons, superintendent here at Southern, and his staff that has been very accommodating to answering a lot of the questions that I have been asking to understand the processes and how just a facility works as a system within the system of DOC. So the complexity that I am finding here has been nothing short of amazing to figure out how Department of Corrections works. But it is, I want to thank the staff here and Mike for guiding me through and helping me to understand how that works. So some of the near future and things to do, as I mentioned, the health data is in the work, DHR data also in the work. We're getting ready for the survey administration. We just keep pushing it off based on a few little IRB process, and should contingencies need to happen on how we administer it. Then we move on to the survey results analysis and the admin data analysis that will culminate. Our tentative schedule for phase 1 is May 30th for the data walk and the presentation, but that remains to be seen depending on how the survey and the analysis takes place. And high on our priority list, which will be coming up shortly for our steering committee, is developing an assessment process for future recommendations that will be coming from the assessment of the admin data and the survey analysis. So how we're going to prioritize recommendations, assess the risk, and assess the need for what will begin to be implemented and how we prioritize that. So that is one of the priority measures that we will be seeing in upcoming steering committee meetings for the future. The next thing there, and this is the last thing before I get into some general discussion, I just wanted you to relay a very smart fellow that I used to work for come up that we always celebrate all of our successes, no matter how small. So the PRIN project for DOC, we've had quite a few successes just from being part of the process. Some of the things, because of PRIN, we've had our first ever master agreement for data sharing. We've gone through that process. It was frustrating for some. It was a monumental task for those that actually took part in that process. But for the state of Vermont and Department of Corrections, getting through and having that first ever master agreement for data sharing is going to prove at least a roadmap for future projects, and hopefully we'll be able to streamline that process. There were some hiccups and some process within that I understand that maybe we can shorten the time frame. One of the big things that also has taken place, and Jessica hit it right on the head when she said we are dismantling internal information silos within DOC between various departments. We are seeing a vast amount of information silos being torn down, and the amount of sharing of what's going on inter-department is nothing short of amazing. There are people who I think they might not have never been asked to share data, and now they're being asked, and there is a constant flow of information just within the Department of Corrections, which I think PRIN has been a helpful means to bringing that to fruition. I'm sure it has been going on, but it's at least building momentum right now due to data requests interdepartment wise. We're also continuing data debt and deficit identification. Here within the facility, there's been a lot of talk with staff, especially the Mike Lyons and his shift supervisors, of how we can look at the data that we have and how it's being used for decision-making process, and how we can streamline how the shift supervisors can identify whether or not the facility is running smoothly. A lot of them base that on gut, and we're trying to figure out how we can also utilize data in order to confirm those gut instincts. We've also started, because of the process and some of the questioning, initiating critical thinking and systems thinking. People are starting to now understand it's not necessarily the actions in front of them, but it's the interactions from those actions of what else. We do actions, but we tend not to think what other, what our actions are going to touch on. And the same thing with our projects. We're starting to look at how PRIN touches other projects and how other projects are touching each other. So there is starting to be a systems overview of thinking, which is starting to take shape. People are asking questions. So that's another short-term success for PRIN. The strategic, like I said, the strategic view of systems and conversation changes within the facility itself. There is a different language being spoken that I can see from some of the activities going on, some of the changes. There is definitely even the smallest of culture change just based on language that's being spoken here. Those are some of the really short-term successes. So whatever we get from here is all good. We have seen some amazing internal and external successes just from PRIN as we are 1 year without even completing the actual phase one. So with that, I'm going to stop for a second, let people digest, and see if anybody has anything they would like to add. I'm not going to go around the room and just ask anybody. So if you would like to say something, if I am off base or something I did not mention, do you have a success that you've seen that I may not have mentioned? I'd really appreciate hearing it. I know it's always tough coming up with something. What I would like to at least touch on, the systems thinking. PRIN is having conversations outside of PRIN and how it's affecting other parts of the agency are really coming into focus. Just to let you know, I'm working on another project that is looking at project collaboration and how everything is intertwined within the agency, and we're looking at how shared resources can be streamlined, and how data from this project is going to affect other projects. In Jessica's case, a lot of the data that's being extracted is going to be very, not only useful for PRIN because it's needed, but very useful for other projects that are going to require the same information. And I see a hand raised. Monica.
Thanks, Brad. What I wanted to do is just kind of thank you for sort of doing that ground setting. I think maybe for an executive committee, it's always a little hard to know exactly, where we are sometimes in a project, and sort of seeing where they fit in, and also understanding that because we don't have the information from the surveys necessarily, doesn't mean that we haven't been doing a lot. And that's hard to see from the outside, right? The meetings that we have on a regular basis, at the steering committee, the individual meetings that Brad and Jessica and Abby and Kathy have together around the data, and they do all point to this really important sort of process piece that I do think is really important to the project. And I think that that's one of the things I know that Urban was interested in looking at as well. It's not sort of the more glamorous part of the work, but it's really important to me, hopefully to others as well, because it puts us in this really great position for the future. So I just wanted to make that comment because I thought it was important to share. And I wanted to thank you for it. Thanks.
Well, thank you. I will actually offer Kathy Culbertson if you would like to comment. Is there anything that we could answer for you if you have questions? Maybe frozen. Okay, seeing we don't have a lot of steady executive committee members, because I know a lot of them were busy. Jesse, yes.
Yeah, the thing that I wanted to add too in terms of success, and I know what you're saying about we don't have the survey data yet, and that once, and it sounds like, it always takes some time to clean that up, but I think the next time we bring this group together, we may have that in hand, if not ready to see. But, to say the survey itself, the level of, engagement around staff and incarcerated people, particularly in a pandemic situation, I think is pretty impressive. And, and I don't think we should undersell the survey itself, which I know it's got to get the final IRB approval, but as an articulation that's also been vetted, with folks back at Southern about what people want to know, like as a statement or something, collaboratively produced about what people think is important to measure and understand about conditions is itself, I think, significant. Obviously, that will show up in a different way once we have the data. But, and I think this is a version of what I said before, but, we coming into this project, we had a lot of ambitions about trying to figure out how participatory a way this work could be done on the front end. And we weren't sure across states where we could get with that. But I think we've gotten pretty far, and now we have to use what's been built to get the data. But that's a lot, actually. I think that's a pretty significant accomplishment. I want to raise that up.
Thank you, Jesse. Anybody else wishing to express an opinion? I will give some final words if Al or Commissioner Baker would like to add anything.
Hey, folks, good afternoon. Al, did you want to add something before I?
No, I'm good. I'm nothing else to add at this time.
Yeah, look, Brad, thanks for that update. That as Monica described, kind of a level setting, so folks are reminded of what we're focused on here. And you touched on something earlier that I think is important for the executive committee to hear, is that, and I don't want to make this too dramatic, but corrections is going through a very dramatic change on a lot of levels. And, not only the work we do in the field, but this effort here in Springfield with the partners that we have gathered is really some groundbreaking work as far as from where I sit, looking down and seeing the work that's being done and the conversations that it's opening up. And you can't tie this directly, but I know that many folks in corrections recognize and understand this. These conversations are driving other changes in the organization. And it's when I hear Jess talk about information sharing, you talk about information sharing, the busting of the silos inside the department, the folks getting a better understanding of what their teammate does for work. And it kind of takes me back to General McChrystal and Team of Teams, right? And that's exactly what the PRIN project is doing. It's creating teams of teams that are being, I hate to use the word forced, but I will, are being forced to work in territory where they're not used to working. And there is never any growth in an organization unless you get into an area where you don't feel comfortable. And that's exactly what's happening right now. So my hat's off to you, Brad, and your leadership, and Kathy and Abby, and the list can go on and on here. But thank you for what you're doing, and our friends from Urban giving us the guidance and being patient with us as we go through growing pains. And I appreciate that fact too, Jesse, that there's been a level of patience with us as we stumble through the early stages of this thing. But I am so impressed with the work that's going on, and I'm going to repeat it again. It's driving change in the organization, and that's exactly what we need in order for us to have better outcomes with the folks that we serve, and we get them to a place where they have a better life and they have a better spot in society where they live, work, and play. And so thank you very much for what you're doing.
Thank you, Commissioner. Our guest from Iowa is back on. I didn't know if she had anything that she wanted to add or ask. Well, I'll open it up to you, Kathy.
Thank you. Hi, everyone. Thanks for letting me join you. And I'm a little bit newer to the Iowa project than Bradley is to the Vermont project. So I'm glad to be able to attend your meeting today and kind of gauge where you guys are at. And we've had in Iowa our executive committee kickoff meeting, but have not had any additional meetings yet. So we'll be meeting again next month and starting some awesome work.
I will let everybody know we have shared our executive committee charter with the other 4 PRIN sites. So they were kind of using what we built based on, I think, the template that Monica provided for that. They are utilizing some of the template that we developed here and using here for their development. So we are definitely sharing everything that's going on here in PRIM in Vermont with our other 4 sites to help and make sure that their projects are successful as well.
Yeah, and Brad, if I may, just as one of the people from the national organization, and some folks on this are probably already tracking this, but just to name it, among other things that are important about Iowa, they're the PRIN site that is a women's facility as their pilot prison where the work is being done. I know that what's happening at Chittenden, and that's been something of interest in Vermont is how things show up in the women's facility, although that's not your pilot prison. So just to say that that's you'll be having things to learn from every state, but just to name that as something at Iowa, and knowing that that's an intersection with things that have been named as of interest at this executive committee in the past.
And again, to reiterate, it's all about information sharing, and we're all going to learn something. So that's the extent. If we don't share, I don't learn anything from not sharing. So my entire drive is to share everything we've got. So hopefully someone else will learn, and then in turn we will learn something back. So, well, I knew this was going to be short. We are 15 minutes from the end of the hour. I always love a generative conversation. If anybody has any questions or anything else they'd like to say, I'll open it up, and if not, we will probably adjourn this, and hopefully the next executive committee meeting in 2 months will be post survey. So I am excited that we will be at that juncture. I'm crossing my fingers and hoping that we will be at that time for some report out and some information sharing as to the survey process. Again, anybody would like to share anything? If not, I will say happy Friday, and I will we'll get the recording up, and we'll get the notes onto the SharePoint. And I appreciate everybody who took the time to attend the meeting, and your conversation is, always learn something new, and I always take away something great from these meetings. So thank you. And I will say again, say happy Friday.
Thank you.